Endometriosis is a term which is not that common. It's not commonly heard by general people. And those people who have come with this problem to the doctor's clinic, they often find it's a sort of difficult term even to pronounce, endometriosis. So it's quite sort of unknown thing and a difficult. So as soon as we say this term, people think it must be a very difficult disease. Now, what is endometriosis? When I was working about nearly 35 years back towards my MD thesis in Calcutta University, my supervisor said, look, this is a topic which is so rare in India, you wouldn't get that many patients to complete your thesis within 2 years' time. But lo and behold, even that time, when we did proper research by investigation, we found that problem is not that uncommon, rather it's very common in the eastern part of India. Endometriosis is a problem, but the lining of the uterus, which is called endometrium, comes outside uterus. That means you find this tissue on ovaries, inside the tummy, sometime on the navel. We have found it in nose and even in chest. Now what happens? Normally when women menstruate, that means when they have bleeding, they have periods, the endometrium is actually shedded from the uterus. At the same time, under the influence of hormone, there is bleeding from those areas where endometrium is present. That means inside the tummy, within the pelvis, from navel, from nose, and even inside the lungs. So these patients have a sort of blood in their sputum. Now interestingly, it happens only during the time of menstruation. So the patients come with the symptoms that I have nose bleeding at the time of menstruation. I'm bleeding from my navel at the time of menstruation. Now it's not very common, but what is common is bleeding inside the pelvis or lower part of tummy. Women, they have uterus, 2 fallopian tubes and 2 ovaries. The endometrium comes out through the fallopian tube and they settle on the ovary, or they settle behind the uterus on the top of the vagina. Now there is no area this blood can come out from. So what happens? That there is accumulation of blood and this lump causes pain, and this pain comes just before the period and it settles when the menstruation starts. So when the patients come to our clinic and give this symptom that I do get pain just before the periods, but as soon as the period starts my pain settles, or this type of symptoms like I've got very bad pain which radiates down the leg, goes down the leg up to my knees only during the time of menstruation, then we know this woman may have endometriosis. I had a very interesting patient, a lady who came, she was about 40 years old. She came to me saying that, doctor, I get knee pain every month during the time of period. Now I've seen so many gynecologists, they say no, we don't treat knee pain, you go and see an orthopedician. And even the orthopedicians are not finding any problem. Now because I have a keen interest in endometriosis, I researched in endometriosis and I've worked in different institutes in UK where they specialize in endometriosis. I immediately diagnosed and she got cured by the treatment of endometriosis. So what we have to keep in mind, the symptoms may not be gynecological, symptoms may be nasal bleeding, symptoms may be bleeding on sputum, symptoms may be knee pain, but if they are related with menstrual cycle, then it has to be endometriosis. Endometriosis can be treated very easily with the help of medicine. Like we need to stop the period. Very interestingly, the endometriosis settles during pregnancy, during breastfeeding, because there is no period. So what we need to do, we need to create a situation where it is like menstruation, it's like pregnancy. So what we call pseudo-pregnancy state, or when the ladies, they stop their period at the menopause, endometriosis settles. So we can give medicine to create a situation like pregnancy. So that woman is not going to have period maybe for 3 months or 6 months, and then the endometriosis problem settles. Or we can give medicine to stop the period altogether maybe for 1 year. Now, for young women, this treatment is not very effective because many of them would like to have pregnancies. By stopping period, we cannot bring pregnancy. So those women who are complaining of pain only, we treat with medicine. Those patients who are complaining of pain and also they wish to have a child, we do laparoscopy. So that's a form of surgery where we put the patient under anesthesia and look inside the tummy with the help of a telescope, and we identify where there is endometriosis, and we use different energies like laser energy, like diathermy energy, which will evaporate the endometriosis. And after clearing this up, the pain settles dramatically and they do conceive very easily. But the problem is, many a time the endometriosis returns, because as soon as they start menstruating, again the menstrual blood will go and accumulate there. So after surgery, once they complete their family, we usually tend to put these patients on some form of treatment so they do not have monthly bleeding. They have bleeding every 3 months. That means 4 bleeding every year. And many patients are very happy with that. They do not want this monthly botheration of periods. And they're very happy even if we put some device like Mirena. It's a medicine inside the uterus which stops their period altogether, although they are not menopausal. So these ladies do not have periods, but they do not have any feature of menopause. They have normal reproductive function and normal life. So most of the time we can preserve all reproductive organs in endometriosis. But rarely we get patients in a very advanced stage where all the structures are sort of muddled up together. They are all attached with each other. And there are big cysts in the ovaries. And there's terrible pain. In those cases, if the family is completed, we actually remove the uterus and both ovaries, which is called hysterectomy. And that can be done by open surgery, or that can also be done by laparoscopic surgery. So the message to all of you is, if you have symptoms like this, pain in the week before your periods, or some form of discomfort or bleeding which comes cyclically, it may be outside the pelvic organ, as I said, nasal bleeding, nose bleeding, breathing difficulties just at the time, please see a gynecologist, and it may be endometriosis. It's not cancer. It can be treated very easily. It can be treated with medicine. If you do not treat endometriosis early, sometimes it can result in infertility. And very rarely, if we neglect the problem, then it can create very advanced endometriosis and such a difficult problem that you may need to have a hysterectomy and you lose your reproductive function and you go through menopause early. Of course, there are treatments to treat all this, but my message would be, please be cautious so that you can identify the problem. It is not uncommon in Eastern India. What we see, the rice eating part of India, like Kerala, like Assam, like Bengal, have more endometriosis in comparison to Delhi or Mumbai, where the rice is the not main, the main meal. It is chapati, and we don't know, as yet we don't know why. It may be related with diet. There may be a genetic predisposition. Maybe people of these part of India, they have more endometriosis. So you can detect endometriosis early by coming to your doctor if you have cyclical symptoms, and I think that is the best way forward to identify it early so that we can treat and cure it early. Endometriosis can be cured, and we can prevent the recurrence of endometriosis by taking some medicine regularly.